Morning. Am I audible? Good. So we are starting with the prayer.
भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. Giving tribute to our great master Samuel Hahnemann for giving us a divine science to all of us and taught us dare to be wise. We are seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who made this divine science and bridges with the modern science to make a homeopathy seem easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijaykaraya Namah. So friends, we are in the journey of reading Organ 1 of Medicines and the book, The End of My Assumptions of Miasm by Dr. Prafull Vijayakar sir. So up till now we have read aphorism number 69 in from Organ 1 of Medicines, and today we are going to read about the aphorism number 70. This aphorism 70 gives the idea of the conclusions or the summary of what we have read in up to 70 aphorism. So this is what we have to keep in mind, that is the theoretical part of the organon is clear from this point, and after 71 The practical part of the organon has been started. So this is what we have read about. So what the conclusion and inference is from this 70 aphorism, it was given into this aphorism number 70. From what has been already adduced, we cannot fail to draw the following inference, that the first inference is that everything of a really morbid character and which ought to be cured that physician can discover in disease consists solely of the suffering of the patient and the sensible alterations in his health, in a word, solely of the totality of the symptoms by means of which the disease demands the medicines requisite for its relief, whilst on the other hand, every internal cause attributed to it, every occult quality or the imaginary material morphic principle is nothing but an idle dream. So this is what the first inference is. Totality of the symptoms is the most important. Second inference is that this derangement of the state of the health, which we term disease, can only be converted into health by another revolutions effected in the state of health by means of medicine, whose sole curative power is learned with the most distinctness and the purity by testing them on the healthy body. So this is what about the proving symptoms. So sole curative power consequently only consists in altering man's health state, that is to say, in a peculiar excitations of the morbid symptoms, and is learned with the most distinctness and purity by testing them on the healthy body. So that is what the medicine, the dynamized medicines which is proved on healthy human being, is the only things which can cure the disease. The third conclusion, that is what, according to all experience, a natural disease can never be cured by medicine that possesses the power of producing in a healthy individual an alien morbid state. So this is what, if it is alien morbid state, that is the medicine which is acting dissimilar to the symptoms, it cannot cure, differing from that of the disease to be cured, therefore never by an allopathic mode of treatment. So disease is not cured by allopathic mode of treatment, and that even in nature no cure ever takes place in which an inherent disease is removed, annihilated, and cured by the addition of the another disease dissimilar to it. We have seen lot of example in the previous aphorism. Be the new one ever so strong. The fourth conclusion is, moreover, all experience proves that by means of medicines which have tendency to produce in a healthy individual an artificial morbid symptom, that is the symptoms of the proving, the antagonistic to the single symptoms of the disease sought to be cured, the cure of the long-standing affections will never be effected, but merely a very transient alleviation always followed by its aggravation, and that, in a word, this antipathic and merely palliative treatment in a long standing disease of the serious character is absolutely inefficacious. So, whenever you are prescribing by the totality of the symptoms by only a few symptoms which is antipathic to them for the palliative purpose, then the disease is not cured. It is just as going into either a separations, or if it is not working, then it becomes solely inefficacious. So this is what the fourth conclusion. The fifth conclusion, however, the third and the only other possible mode of the treatment, that is the homeopathic, in which there is employment of the totality of the symptoms of the natural disease. A medicine is capable of producing the most similar symptoms possible in the healthy individual, given in a suitable dose, is the only efficacious remedial method. So, this is what allopathy is not efficacious, palliative mode is not efficacious, the only efficacious mode is the homeopathic, whereby diseases which are purely dynamic deranging irritations of the vital force are overpowered and being thus easily, perfectly, and permanently extinguished must necessarily cease to exist. So this is what the only things happen with the homeopathy. This is brought about by means of the stronger, similar, deranging irritations of the homeopathic medicine in the sensation of the life principle. So this is what why it is stronger, because whenever you dynamize anything, it becomes stronger. So inherent property of that medicine has to be aroused into activity, and that is what the stronger, similar manner. For this mode of the procedure, we have the example of the unfettered nature herself, when to an old disease there is added a new one similar to the first, whereby the new one is rapidly and moreover annihilated and cured. So we have seen a lot of example in previous aphorisms. So this is what the conclusions of aphorism number 70. So friends, we have read these books with the concept of my assumptions of the miasm. That means the end of my assumptions. So up till now, a lot of assumptions about the miasm is there, and that assumption has been ended with this the understanding of the miasm in the light of the genes. So whenever we are understanding that the miasm is just the defense mechanism of the genetic apparatus or a genetic code, and which is in the three process which we called as the functions of the cells. For the functions of survival, cell has to have a organization. For the functions of survival of the species, cell has to have reproduction, and for the survival of the self and survival of the species, the function has to have a defense system in that cell. So this is what a genetic code. So we up till now we have read about that the everything is governed by the genes and genetic code. So the defense mechanism is also governed by the genes and genetic code. And there is a defense mechanism according to cells are the two variant. That is, one is a physiological defense mechanism and one is a pathological defense mechanism, or a morphological or a structural defense mechanism. So morphological structural defense again divided into two processes. One is a constructive morphological defense mechanism and one is the destructive morphological defense mechanism. So this is equivalent to the SORA, psychosis, and syphilis, respectively. Then we have learned about the disease related to the SORA, disease related to the psychosis, and the disease related to syphilis. After that, everything is fine. Then we have read about the mental aspect of entering into the cell. So the cell, whenever in the soric stage, they have to work conscientiously, diligently, and everything. So this is what the conscience of the cell function. So homeostasis has to be maintained. So this is a sora. Then, when the psychosis is overpowered, the cells feel fragile and the facades and everything has been started. The projection has been started in that cells, and then the psychosis enter at the level of mind. And when the cell started destruction at the level of in the form of necrosis and apophysis, the same way at the level of mind also cells started destroying the self, and it may goes into out of control distortion and destruction. So this is what we have read about that. After that we have understood that the each and every medicine which we have learned in our materia medica, from the polycrest to the everyone, all they having the defense mechanism. So we have to read the medicines in the three phases, that is the tri-miasmatic materia medica. Then also we have learned about the rubrics related to the miasm. So certain mental rubrics categorized into the soric rubric, certain mental rubric categorized into psychotic rubric, and certain mental rubric categorized into syphilitic rubrics. And then lastly, we have read about the brain dominance from the right-sided and left, right brain dominance, left brain dominance. So right brain dominance control the left side of the body, left brain dominance control the right side of the body, and its quality. So up till now we have read these things. Now today we are going to read about the miasmatic process of a cell at the level of, and that is what psychosis. So this is what the genetics of psychosis. So up till now we have read these 30 chapters, and now starting with the Genetics of psychosis. Now, what is the genetics of psychosis? So, to understand this process, we have to understand the process of the cell divisions, and in the process of the cell division, how cell is divided and what are the system is related to the cell division. So, psychosis is a proliferation of the cell as well as other products. This shows the problem with the cell division control and the protein growth factors. So, this is what we have to understand. To understand the probable cause of the psychosis, we need to understand the cell division cycle. So, cell division is regulated by the cell cycle control system. So we have to understand what is the cell cycle control system. Cell cycle control system. So the figure was given is in the back of the page. So I will show you that figure. 274. Yes, this is the figure of cell cycle and cell control. So whenever the cell, there is a starting point below. Then cells started multiplying. So there are the some checkpoint called as a G1 checkpoint, S, G2 checkpoint, M checkpoint, and then the cell goes into division. So this is what this checkpoint is giving rise to a process that either cell become big enough proper, so cell growth is proper or not, is environment is favorable or not. So that is what has to be checked here, then goes into S point, then goes into G2 checkpoint. So in G2 checkpoint, there is one is called as a cell. There is a three process. One is called as a cell growth. Second is called the synthesis of the protein, and third is called as a metaphase checkpoint. So control everything is in DNA and everything chromosome is in a proper alignment or not. So this is called as a cell cycle. So whenever we have to understand this cell cycle, so if the mitosis is happening, that means anything which is proliferation is happening, anything which is out of control, anything which is excess, not out of control, anything which is excess, which is needed for the survival. So what thing changes happening in this cell cycle has to be noted, and then we can understand that this is the process of psychosis has been started. So go back to our reading point, that the cell cycle comprises of two phases called as the mitotic phase, where there is a cell actual divided, and the resting phase wherein the cell prepare for the mitotic division. So the mitotic phase consists of the prophase, prometaphase, metaphase, anaphase, and telophase. The resting phase is also known as the interphase, where the DNA replications take place. The interface is divided into three parts. One is called as G1, S, and G2. So every cell which has to duplicate has to undergo above these three phases. During G1 phase, the cell monitor its environment and its own size. If everything is normal and the cell is found fit enough, it is allowed to proceed to the S phase. In S phase, the DNA replication takes place. That means the cell gets ready for the 1 to 2 multiplication genetically. Here the synthesis of the DNA to the RNA has been started. Then G2 phase. The G2 phase, the cell ensures that DNA replication is complete and proper, and only then the cell is allowed to proceed to the metaphase, M phase. That is called mitotic phase. So every cell which divided by the mitosis into two of its own kind has to undergo this cell cycle, which is controlled by the certain protein cyclin dependent kinase CDK1, CDK2, CDK3, etc. In this resting phase, we have two checkpoints G1 and G2. The G1 checkpoints regulate the control and the entry of the into S phase, and the G2 checkpoint regulates and control the entry just before cell enter into mitosis. So this is what very important aspect of understanding. Now, G1 checkpoint ensures that every cell that has optimum growth and optimum cell environment. If the cell passes through the G1 checkpoint, it replicate the DNA from 1 is to 2, that is a cell controls. Proliferation lies in the G1 checkpoints. If the cell are going in for a more replication, G1 checkpoint checks them and does not allow them to proceed. So this is what very important aspect of. So there is one break also here. There are certain cycling-dependent kinases, namely CDK2, which combines with the cyclin E to help the cell to overcome the G1 checkpoint or the pass the checkpoint even if the cell does not have proper growth. So there is a break. In a normal condition, there is a break system. But whenever there is a, say for sir always says there is a what we called as toll plaza. There is a toll plaza, and everyone has to pass through that toll plaza, and they have to pay the things, and then they go. But those who have some another connections to the ministers and everything, so they have not given that. So this is what one, if this CDK is combined with the cyclin E, that means it is a password, or this is called this is passport to enter to without checking. So this is what this receptor is combined to this cell and without checking. So cell proliferation undergo more and more. So this is what here happening. So here how this happen? This is happen because of the law of psychosis, and the law of psychosis is cheat everyone. So it seems that it assumes that I am normal. I am looking same. I am growth properly, but behind that there is a motive is different. So that is what the bribe, or that is something they have to give to overcome that. That is what the psychosis. So G1 checkpoint has the point where the proliferation has been started. So the G1 checkpoint or past the checkpoint even if the cell does not have proper growth. So either extra growth or either less growth, cell has checkpoint is not working properly. So that is what they pass, and then it goes into a psychosis. So this is probably the start of psychosis. Here, cells try to bribe its way or manipulate its way through the checkpoint and hence try to synthesize more DNA so that the more than two cells are produced. So this is what psychosis has been started. This is the start of proliferation, excessive cell productions, productions or the synthesis of the protein and the enzyme. Thus, probably psychosis sets in. The psychotic constitution probably has more of these CDK2 and cyclin E combinations, which makes them undergo multiplications or a defense by constructive since birth. So this is what how cellular level psychosis has been started. You have to be keep in mind that everything is a science. So science has given an answer that why psychotic constitution, because they have CDK2 and cyclin E combination. So that's why they goes into more cell cycle, more cell proliferation and more cell regeneration. So they develop psychosis at early age also. A person having a predominantly storic miasm may be suppressed by drug or other factors, or and the G1 checkpoint could sorry. A person having predominantly a psoric miasm may be suppressed by a drug or other factor, and the G1 checkpoint could be overcome, thus leading to psychosis. So this is what blooming of miasm from psora to psychosis. This is probable explanations for the children going from psoric recurrent inflammatory disease to the psychotic disease after operations of the tonsillitis and appendicitis. So this is what you have to keep in mind, that the psora has been cut off, so it directly stimulates the psychosis. Many patients start becoming fat after delivery or after a major operation or after an acute inflammatory disease like a typhoid, pneumonia, hepatitis. This is when the psychosis gene is activated in the persons. We homeopaths also suppress. So here it is a psychosis. That means it is a benign in nature. Now in cancer too, it is the G1 checkpoint which has seen to be defective. But one gene giving rise to multiplication tendency, that is overcoming of the G1 checkpoint, is the same as what is probably called as proto-oncogenesis. genes. So in cancer, there are the oncogenes is responsible for the development of the cancers, and there is a out of control proliferation. So one proliferations or the development psychosis mitosis is in a control, and one uncontrolled or out of control proliferation which is called as the cancer. So here very important, both have the same mechanism, but there is something is there. So G1 checkpoint is represent as the one of the proto-oncogenes. So one oncogene does not necessarily cause the cancer. There are the few things has to be there. So what is what? One is proliferation is increasing, but if the apoptosis is also working, then the cell remain in the balanced system, that is a benign. But proliferation also increasing at one point, one oncogene is working and another oncogene which is acting as a brake, or so one is accelerator, one is a brake. So if brake is not working, so accelerator going and going and going, so that is called the destruction and that is called the cancer. So out of control. So accelerator is going on, but brake is not working. So that is what the things is. So there is a two oncogenes is working in a cancer, and that second oncogene is called as gene P53. So one oncogene does not necessarily cause the cancer. It requires minimum two oncogenes to cause a cancer in the person. The presence of one oncogene stand for the cancerous diathesis. That means we have a diathesis. Diathesis means that there is one oncogene is present, which is another word may be equal to the psychosis, because it is just a multiplications and proliferation. The genes of proliferation is responsible to police the normal cell. That means what, there is a control system is there. There is another gene called as gene P53 which act as a brake on the excess cell proliferation. So this is what very important, this genes is working as a brake. So beyond that, it can cut that process and does not go into metaphase. So that is the proliferation had not been happening. But if this break also fail, then it goes into a cancer. So gene of proliferation can be either inherited from the parents or acquired during the lifetime by the process of reverse transcriptions. Those who inherit are the psychotic constitutions and those who develop because of development of the SORA to the psychosis to the syphilis. It is due to reverse transcription of the RNA. So hope you understand the process of psychosis. Now we have to understand the genetics of the cancer. So again, the same thing is going but without break. Previously it is with the break, so that it is in a control. That's why in the medicine book it was written that the anything which is in a growth, there are the two type of the growth or a tumor which we called as, one is called as a benign tumor and one is called as a malignant tumor. So benign tumor having the brake is working, whereas in malignant tumor the brake is fail. So that's why it is a cancer and that's why it is a psychosis. So any tumor is comes into psychosis, but out of control proliferation comes into syphilis or a cancer or a destruction. So this is what we have to understand. So in this chapter, the genetics of the cancer. So cancer is a result of the genetic mutation. So when genetic mutation takes place, there is a gene called as gene P53 which act as a brake on excess cell proliferation, not allowing mutated cell to go further into cell cycle. So this genes is very good genes for not allowing the mutated cell to go into further cell cycles. Okay, this prevent the malignancy. When P53 genes is defective, so someone has given bribe to these genes by means of some imaginary process or by means of some biochemical changes at the level of these genes. So these genes is become defective, and when these genes become defective, the cell break fails and the mutated cells proliferated. So there is what that is called as a proto-oncogene turn into oncogene. So there is a proto-oncogenes, the oncogenes which is pro before that, but when it is activated, then it become oncogenes. So this is what oncogenes is activated. So we understand that our constitution is based on the genetic code, which is has the representations of our physical and the mental characters. If a part of the proto-oncogenes is replaced by the DNA, which has been reversely transcribed, a new oncogene is formed. The cancer can be formed only if there is a two such oncogenes are there. So you have to keep in mind that psychosis, there is one oncogene is working, that is for just a growth. Whereas in a cancer, two oncogene is working, the accelerator is also working and brake is failed. So that is what the cancer is. This is something like from a thick book of a Robin's pathology, a few pages have been removed and replaced by the pages of the Kent Materia Medica. This book does not make sense in this state. It is no more Robin's book of pathology. Same is in the case with the cancer patient with the genetic mutation. So you have to understand that if the genetic mutation happen at the cellular level, then there is no means of anything. So this is what you have a book that is your normal cells like Robin's pathology. Few pages of Robin's pathology is removed and another few pages of the Kent Materia Medica has been kept inside. So that is a mutation has been taken place at the genes. Then this signifies nothing. This is what out of control. Thus, in cancer patient 2, the basic of the original constitutions. So here very important aspect of understanding is that when the Robin's identity has been lost because of these few pages of the Kent Materia Medica in Robin's pathology being. That means what the basic character of that Robin's pathology has been lost. So here we have to identify that the constitutions that thus in cancer patient 2 the basic character of the original constitutions are not helpful to prescribe upon. This is very important aspect of understanding that you need to treat the body first then the whole patient. Okay, so that is very important. Each genetic alterations may cause phenotypic changes typified by the progressions in the epithelial tissue from the hyperplasia to the adenoma to the dysplasia to the carcinoma in situ to the invasive carcinoma. This is what the phenotypic changes happening out of genetic alteration. So whenever there is a phenotypic changes happening out of genetic alteration, that means gene has been mutated. That means the original genetic code has no value. Now you have to understand this phenotypic change, that is the change constitution, that is called the change disposition, and we need to target that only in each and every cancer cases. Very important aspect of the phenotypic changes typified by. So how the phenotypic change is typified by in the cells, it may start with the hyperplasia, it may go into adenoma, it may go into dysplasia, or it may go into pre-carcinoma, carcinoma in situ, or finally land into invasive carcinoma. Cells have evolved mechanism to resist the neoplastic transformations. When this mechanism is distorted, the cell grow out of control. This means the defense mechanism has been failed. The brake have gone. This amount to the syphilis. Thus, the cancer at the genetic level is called as syphilitic, even though the presentation is growth. You know, the presentation is growth, then also it is called as syphilitic. In previously mentioned genetic mutation, the cancer it is advisable to prescribe on the phenotypic simillimum and not the genotypic simillimum. Very important aspect of understanding. Genetic mutations cancer are advisable to prescribe the phenotypic minimum, not the genotypic. So genotypic means the GCS, phenotypic means the change disposition that we have termed as a state remedy, that we have termed as pathological simillimum PCS. So that is what you have to keep in a mind. The change phenotypic simillimum is based on the changes in the general, physicals, and the mentals occurring after the onset of the cancer due to respect of the strong psychotic symptoms, which is not changed before and after. So this is what you have to keep in mind whenever you are treating a cancer. You have to keep this into consideration, the change in the generals, change in the physical, change in the mentals after the onset of the cancer with a due respect of the psychotic symptom. That means the base is there, which is not changed before and after the disease. So that you have to keep in mind. Okay, So according to Harrison's, so sir has given approach here also, approach to the cancer. According to Harrison's, there is a 5 series of the phenotypes occurring in the cancerous growth, and possibility of the changing of the simillimum at every structure of the changes will lead to the homeopathy to fantastic possibility of cure in the cancer. So there is, according to Harrison, there is a 5 series of phenotypic changes. So same way we have to keep changing certain treatment when there is a cancer. So also Hahnemann has mentioned in aphorism number 167 or 177, there is a several antisoric remedy to be given in succession to cure the case. So whenever the symptoms arises, that is the totality of the symptoms of particular phenotypic changes, that has to be subsided with one remedy, then another remedy, then another remedy, then another remedy, and then successive antisoric remedy help to cure the patient. So this is keep in mind, this is in keeping with the treatment suggested by Hahnemann's aphorism, where he mentioned that the treatment of the one-sided disease and the disease with the paucity of the symptoms. But there is another type of the cancer, which is, so this is what Hahnemann is mentioning this. But there is another type of cancer which is called as a genetic or epigenetic, that is, which is epigenetic in nature, where the genetic mutation does not take place. So one is phenotypic, where you have to give a change dispositional remedies, whereas this is epigenetic cancer, that in which there is no genetic mutations has been happened. So another type of cancer which is epigenetic in nature, where genetic mutation does not take place and only expression of the genes is changed. In that case, you need to prescribe the GCS, genetic constitutional. So here, sir always says epigenetic cancer are easy to cure. Here, the genetic constitutional simillimum based on the original constitution still works. So such cases are most commonly found in old age. So old age cancer. So 79 years male presented with the prostate cancer. In that case, you need to take a whole history of the patient whole life, not the state of that particular cancer. So that is what the epigenetic cancer. And the prognosis with the homeopathic treatment in such cases is better than the genetic mutations cancer. So this is what you have to understand. We have last chapter, we enter into the last chapter of this book. So today we will conclude this book. Some practical hints what sir has given us to understand the this book, and summary of this in this last book, last chapter. During the course of the treatment, the patient may develop early sign of suppressions from one miasm to another. It is imperative for every physician to know this, because we will realize it only if we have knowledge of it. So this is what very important understanding. During the treatment of the recurrent tendency to cold and cough, and many children develop minute pinhead like white spot. Pinhead like white spot, that is called as tinea versicolor. This is the wrong direction even if the cold is better. This indicates that the suppression from the sora to like syphilis. That means pin matlab pinhead like a white spot. White spot means either initially it start with the lessening, that is a tinea alba, and then it goes into a destruction of the melanocyte, that is called vitiligo. This is what from psychosora to syphilis. This indicates that the constitution is predominantly a syphilitic in nature. If the cold cough tendency disappear and child start putting an excessive weight with the lethargy, that is also a wrong direction. It start from the sura to psychosis. A patient may start putting on excess weight and become obese after certain operations like the tonsil operation, appendix operation, hysterectomy, after treatment with the acute infectious disease like typhoid, malaria, hepatitis, pneumonia. All this indicate that the separation from the sora to psychosis. So whenever you are taking the JOD, journey of the disease, you need to ask about the each and every disease the patient is suffering from, and then you have understand that Up till now, the patient is defending in the psoric miasm. After a certain period of time, he developed a psychosis and he also developed a disease also of a psychosis. The same thing you have to keep in a mind. Children start becoming dull and losing interest in the study indicate the onset of psychosis. Very important aspect of after the medicine has been prescribed and child become dull and losing interest in the study. That means you are treating a case of a simple recurrent tonsillitis. The patient was better with the tonsillitis. And then the patient's mother complained you that previously he used to score a good marks in the classes, but now he is getting lesser marks and now he becomes so healthy. Thank you, sir, for treating my child with this. But now give me a remedy for this. This intellect has to be increased. So this is what you understand that this is again a suppression from the sora to psychosis. It is a onset of the psychosis. Again, whenever you are treating a tumor, fibroid, or on the way to cure, there is exteriorizations of the disease, and in exteriorization in the form of either a ringworm or a tinea or a viral rest, it is a welcome sign. So this is what you have to keep in the mind that virus has been come out, that the ringworm has been come out, tinea has been come out. This is exteriorization. Whenever you are treating a psychosis, then it is a welcome sign. Sudden onset excruciating headache mimicking the meningitis or the sudden behavioral changes in the young hysterical children, which are diagnosed as a space occupying lesion, may be due to the local applications on the cracks or the eruptions on the lips a week before. These patients are admitted to the hospital and generally diagnosed as a tubercular meningitis, etc. There is a suppression of the psychosis and syphilis on the skin to the neuroectoderm, and these emergencies can be cured by the homeopath within 24 to 48 hours with the right simillimum, which brings back the eruptions on the lips. So this is what we have a certain remedy that eruption got suppressed goes into a convulsion. So convulsion is the representation, but that is what the toxin transform from the ectoderm to the neuroectoderm. So there are the remedy which goes from this to this you have to keep in a mind. And whenever you apply this in the case, then the patient become normal within 24 to 48 hours because toxin has again transferred from the neuroectoderm to the ectoderm. Sudden suppressions of any discharge leading to the exploding pain anywhere in the body is a metastasis of the toxins, and this pain can be easily cured with the abrotenum 201 or at the most two doses if not much time has been left. This is what Sir clinical experience and Sir has given this that if the patient having diarrhea and the diarrhea has been given a medicines for the diarrhea and diarrhea has been suppressed and suddenly patient may develop acute neuralgic pain or patient may develop toothache, severe toothache. Uh, if the time has not lapsed, then the abrotenum 200 single dose has been the remedy and that prescribed and sir got wonderful result. If any patient comes with the acute onset of the toothache or abdominal pain or the ear pain without pus, one should inquire that what were the discharge which occurred before it was. Was it cold? Was it coryza? Was it loose motions? Or the just inflammations of the throat? Even if such a history is not available properly, one can safely presume the history of suppressed inflammations or the discharge, and the abrotinum will create a miracle. So this is what the source Hindi tips for this. So abrotinum is one of the most neglected miraculous remedy which can give credit to homeopathy in treating the emergency. Even old people going into drowsiness or the constitutional state after a suppression of the knee pain or a knee joint pain to the backache to the neck pain to the stuporous conditions will be cured of such a cerebral conditions with the abrotinum sometime repeatedly. So here the repetition is needed. The repetition is advocated because of two reasons. First, the vitality of such drowsy patient is low, and secondly, the abrotinum here is a partial simillimum to the state of metastasis from the sora to psychosis, that is inflammation to the stasis. It is used to bring the toxin that have traveled higher to the more important tissue back to the less important organ. So this is what the things you have to keep in a mind. This is the handy tips of search. Inflammatory tendency before they turn into indurations are volatile. We observe in many patients that they suffer from the headache for the many years, almost say 20 years. Then at the age of 40 years, this headache, which were paroxysmal, become more permanent. Gradual headaches are accompanied by the visual disturbances or memory lapse or the blackouts. Now the patient is investigated and canned for it and found to be suffering from the SOL or a tumor. It could be astrocytoma, meningioma, glioma, etc. What is interesting is that if the headache were present for many years, then was this tumor also present for so many years? The question is like, except for the slow growing tumor, this is not possible. This means the growth of the tumor is a recent development and it can be traced back to the point when the headache, which were paroxysmal, become continuous. This was the transition from the SORA to the psychosis. Before this point, the headache were due to just inflammations or the congestions of the tissue. After this, the inflammation got converted into chronic state and the induration and growth has been started. This is true of all the tumors. There is a time when the disease is in the liable state, deciding to invade a new territory. At this time, the symptoms are paroxysmal, coming and going. Once it decided to settle down in the new tissue, the symptom become permanent. So this is what you have to keep in mind to take a proper history whenever you are taking a GOD or the history of the patient of the disease. Understand the symptoms in this manner. If the symptoms is labile or changeable, up to that time the patient is defending in the physiological manner. And if the symptom become permanent, that means at that time again that physiological state changes into a morphological defense mechanism and goes into either a psychosis or syphilis. So significance of this understanding for the homeopath is that as long as the disease is threatening to invade or is in a labile state, the causative factor is important. So if the physiology is working, the causative factor important, that means ailment prob is important. Once the disease has settled down, that is the inflammatory stage is gone and the thickening or growth is sets in, the rubric ailment from does not bear important, but the sensitivity remain the same, but the rubric is not taken into consideration as a ailment. Clear? This is what Sir Sandy tips. Very often, girls suffering from the vitiligo or leukoderma are seen to be developing a boyish or the mannish habit. This is because of MSH, melanocyte stimulating hormone, is synthesized inside the pituitary from the nervous system, which are quite in the close proximity to the ones which synthesize the prolactin and luteinizing hormones. This female hormone control the ovarian hormone and thus control the feminism. So menses become irregular during the course of vitiligo treatment, amount to the suppressions or the wrong direction of the cure. So this is what keep in mind, very important. So whenever you are treating the vitiligo in a female patient and before that the menses was normal and after the treatment menses were become irregular, that means the suppression has been taken place. Okay, physiology has to be remain maintained and normal. The destructive tendency, syphilitic, which is disturbing the MSH productions, if suppressed, disturb the feminine hormone production, and the patient start feeling and behaving like a boy's clothes, head, girl's clothes, ornaments, lipstick. The feminine hormone production decrease, and the patient start feeling and behaving like a boy. And in a young girl, menarche is delayed. Again, it may end into the homosexuality, which is a worst stage which follows. In such cases, cure should not start from disappearance of the leukodermal spot, keep in mind, but from the change in the behavior. Mental attitude has been changed. So the girl should start liking girls' clothes, girlish toys, feminine ornaments, start feeling like a female. So the role for which she was born, then and then only should physical improvement in the white spot start, and that too from the above downward. So this is what very important aspect of understanding the vitiligo cases when the behavior also changes. So first behavioral will changes and then the physical structure will be changes. Danger of MRI. This is what Sir has said that there was a fast growing astrocytoma. This is a cancer case which was operated and grew again. When the case was seen by me, she was in the intensive care of the Jaslok hospital, lying unconscious. She was chilling. Since young age, very reserved, introverted, much responsible, religious, conscientious, and diligent to the extent of working in the kitchen. Even with the severe headache and the giddiness, before she was hospitalized, she used to suffer from the sun headache off and on since childhood, and with the increased thirst and desire for bread. On the above basis, she was prescribed natrum cap 30 single dose. She became conscious, was brought home, and started walking, talking, and finally dancing too. She went on to get her re-investigated on her own instant and against my advice, and to everybody's surprise, the MRI shows the complete regressions of the tumor. They were happy, but I was apprehensive. My worst fear came true as she developed giddiness 3 days after the MRI done. Within 3 weeks shows the regrow of the tumor. She became unconscious and died in about 6 weeks time. The repetitions of natrum carb, changing of the potency, nor changing of the remedy helped her. The question is what happened and why this happened. The answer is simple. MRI had caused the regrowth, but can a non-invasive technique of MRI cause the tumor? The question is this. So MRI is a mode of investigation in which the human being is placed in the strong artificial magnetic field. The cell and tissue are influenced by the strong field in such a manner that the magnetized element inside the cell are aligned in the certain manner. When the magnetism is stopped, the elements start realigning themselves in their natural place. This process is picturized to find the existence of the tumor and the destruction. This aligning and realigning of the internal environment of the cells and the tissue amount to the injury. Even Hahnemann mentions in aphorism number 73, he mentioned about the meteoric and telluric influence, which are essentially a strong magnetic influence being injurious to the cells and hence exciting the disease, exciting the cause. He has mentioned them only in acute disease, meaning those which are outburst of the latent sora. For us, sora amount to the inflammatory tendency, and that is physiological. And we understand by now that the strong psychotic constitution goes to the second defense, that is constructive defense, immediately and quickly after the sora has been cut off. In this case too, the cells of the nerve astrocytes which were limping back to the normalcy were coming back from the psychosis to the sora again. At this stage, the cell astrocytes are very sensitive to the slightest irritation. The MRI irritations was enough to injure and produce the constructive defense again, which was genetically inherited in that constitution, and this led to the growth of the tumors. This cannot happen in all cases exposed to the MRI. Only those constitutions who are oversensitive, like a natrum carb, run the risk. So this is what you have to keep in a mind. It is best not to do a repeat investigation if the patient shows such a drastic, unimaginable improvement. Investigation at this stage does not serve any constructive purpose. Even biopsy or a fine needle aspiration cytology is an invasive procedure which is bound to injure the tissue whose genes are already defending hyperconstructively. We find in a daily practice that the malignant tumor get aggravated after the biopsy. So this is what again the cell injury takes place. Another tips by the sir, that is a psychotic constitutions, the people are liable to be more affected by the prolonged grief. It is something like an iron bar which undergoes stress for a longer time and gradually changes in the shape. The psychotic constitutions people therefore mostly suffer from the gradual progress psychotic disease under stress. Vice versa, if the persons come with a gradual progressive psychotic disease like a diabetes or a tumor, it is more likely that this constitution has been affected by some prolonged grief. So psychotic some prolonged grief, mortification, vexations, indignations, and not from the anger, fright, or sudden joy. So this is what the cause of psychotic disease. Syphilitic constitutions, so people are liable to be more affected by the anger or a fright and thus suffer from the syphilitic sudden disease like the motor neuron disease, infarct, and paralysis. Most of the time, it has been seen that the patients suffering from the cancers, when get cured of the cancers, are left with the diabetes, which is as good as compensatory cure as the disease came down from the third defense to the second defense. So that means the syphilitic defense to the psychotic defense. So compensatory cure mostly found in cancers. Okay. Tumor which are due to the constructive miasms and are more stable when disappear are liable to produce a disease of psychosis accumulations like diabetes, hypercholesteremia or the renal stone which are the welcome signs. So a dynamic disease when getting better then the dynamic psychotic disease has been started. So that is what accumulative diabetes, hypercholesterol or renal stone. When the patient suffers from the grave disease like a cancers and the tumor, he cannot get common cold like a cold, cough, viral fever. Thus, the presentations of the common disease is short signal that the patient is getting cured. So, in old age, whenever the patient having a psoric symptoms, be sure that the patient is good. But once it is psoric symptom has been suppressed, it may end up with the syphilitic disorders. Tumor viruses, the human papilloma virus, the Epstein-Barr virus, hepatitis B virus, hepatitis C virus, human T-cell leukemia virus, etc., all of which are the tumor viruses, initiate psychosis or the constructive defense, followed by syphilis. So this is what the tumor virus is, or the destructive defense pathology. When the patient is being cured of malignancy, this is what very important aspect of understanding caused due to these viruses, they might develop growth-like pathology like warts or polyps on the skin, and that is the welcome sign. So this is what very important when the patient is cured from the malignancy, and if the patient develop warts or polyps, that is the welcome signs. Chickenpox virus, which also causes herpes zoster, rubella virus, cytomegalovirus, herpes simplex virus, are similarly the psychosyphilitic in nature and get exteriorized in the form of ulcer in the mouth, cracks on the lip, or mealy rash during homeopathic treatment. So this is what you have to understand when you find that the exteriorization in the form of ulcer in the mouth, cracks on the lips, or sometimes it is a mealy rash. Keep in mind that virus has to be comes out specifically in psychosyphilitic cases. Very important. Okay. So we have as far as sir given a lot of understanding about this and we have concluded everything. So this is what the conclusions of the miasm. We will continue this conclusion tomorrow morning. So we conclude our book tomorrow and hope you all learn and understand many things from this reading of books so you can get the idea of how we have to adopt our plan to treat the patient with the tool of miasm. Okay, we have a question answer sessions on the Sunday. I will share the link into the group so you can have Google Forms. So up till today afternoon up to 4 o'clock you can send the question in that link so that I can make a presentation for all of you and we will have discussions on Sunday morning. So I will share the timings and the new link for the Sunday link. Dr. Kiran has asked one question that in case of cholesterol, if the patient got ringworm as the exteriorization, is it good or the bad signs? Is it good sign? But keep in mind, cholesterol has to be normalized along with the ringworm, development of the ringworm. Then it is a good sign. Otherwise, the both have the same miasm is working at the same place. So cholesterol is there. Where you put the cholesterol, in which layer? So I will conclude here. We will have a yes, Dr. Kiran Yadav. So I had one. I had to visit one patient nearby my house. So I will conclude this, and we will have question answer sessions on Sunday. So you can directly ask that question to link provided into the group. Okay. Thank you so much. Thank you all, and thank you for all the blessings and prayer for my mother. My mother is well, and she came back home with the healthy. Everything is healthy. So thank you all.